Hi, my name is Mary Moran, and I'm 24 years old. Some of you might recognize that name. Some of you might recognize it if I tell you that on February 6th, I was in a really bad car accident. Unfortunately, I don't remember much about that day, but from what people have been telling me, I ran into the back of a semi at 55 miles an hour on 71. I was trapped in the car for an hour, and that's when we had first responders, EMS, fire, and the fire trucks come and sustain my life while I was in a shattered car, which is a pretty big deal. What happened next was that they called my husband to tell him that they were life-flighting me to Grant Hospital. Not much of you know about my life previous to the accident, but I have always been a huge advocate for others. A lot of different groups have affected my life, and I hope that I've been advocating for them. I also teach others how to advocate for themselves. And at 24 years old, I never thought that I would need an advocate to help me through a situation. But I'm so glad I did. Without the help of all of these people who were at the scene of my accident, I wouldn't be here today. They made decisions with their knowledge and expertise on how to save my life and to sustain it at that scene of that accident, which was horrendous. And then made the decision that I was serious enough to get life-flighted to Grant Hospital. Without them, I definitely wouldn't be here today. And I really am grateful to have the opportunity to say thanks. I know that a lot of people have this experience with life flight or with EMS and first responders. They may not remember what happened, just like me. But they don't know how to say thank you or where to say thank you. So I'm really grateful that it's here. I also think that a lot of people would say that accident was the worst day of their life. And I'm never going to be able to say that. If anything, it's one of the greatest experiences I've ever had. I got to meet so many different people. I got to learn so many different things about the medical profession. And I got to get a totally different perspective on life. I got that second chance at life, and I'm definitely not going to waste it away thinking about deadlines and everything like I used to. I'm going to be enjoying life in the moment and understanding that life can look so differently now, which is such a blessing. And thanks to all of you sitting out there that I have that opportunity to get a new perspective, a new change at life. If it wasn't for you, I would have been stuck in that car, and I don't know what would have happened. A lot of you, if people ask you who you are and what you do, some of your answers might be nurses, flight crew, EMS, first responders, firefighters. But people who have been through what I've been through, people who you've encountered, changed, impacted, and saved, might have a different name for you. And for me, it's guardian angels. And I just want to say thank you.
Hi, my name is Josh Moran, Mary Moran's husband. On the day of February 6th, I got a phone call from the dispatcher with the Ohio State Highway Patrol that my wife had been in a very serious accident. She was okay, but she had the only information I had was that she had some lower extremity injuries, and that she had. They told me it was on 71, and I'd looked at the clock and it was 4 o'clock, and I knew that she was supposed to be home at 4 o'clock that day. So they said it was in Mansfield, and that meant she'd been in the car for an hour. And by the time they had gotten a hold of me, they were just making the decision as to where she would go, and they said that she was going to go to either Grant Medical Center or Ohio State, and that they'd made the decision that she would go to Grant, and it's probably the best decision that could have ever been made. I can't thank you enough for everything you did that day. She's a very special girl to many people. And we actually got to, I don't know, exponentially increase the size of our family after this experience. We've met so many great people, and we can't thank you all enough. I got here about a half hour ahead of the helicopter, and was waiting, and I got to hear the trauma call come in when she got here. And there were a bunch of people that came in and met with me and talked to me, and I got to meet Mary's flight crew. I don't remember them because everything was happening so fast, but I got to shake their hand and meet them, and I can't thank you all enough for everything you've done, and let me have my Mary back again. And I want to thank you all for everything you've done, and I'm just happy to have Mary back.
Mary and Josh, we want to thank you for, extending yourselves and showing, your experiences to all of us. We don't oftentimes see that. I have to be honest, when I saw her name came up, Mary Moran, it did strike me that I recalled that name, and I was one of many caring for you in the trauma bay that day. We thank you for being here today. Your spirit and positive attitude is contagious. Times like this, you go into crisis mode, and it makes you a much better person, wife, contributor to your family. So think of it as a lucky thing in the end, because you're going to be a strong individual for it. And I would just ask you if Mary and Josh Moran, if you would come forward.
Hey everybody. Okay. Big Ben chimes at 6:30 a.m. on my alarm. I do my hair, my makeup, get dressed, I brush my teeth, grab my bag, kiss my husband goodbye, and I'm gone. Where to first? The first appointment of the day. I can't believe I'm sitting here wasting 2 hours in the car again. What is it that I have to do this week? How many hours can I get for internship? Is there any way I could manage to graduate with my master's in marriage and family therapy this semester with all of those hours? If anyone can do it, it's you, Mary. I think I might have a chance. Finally, I'm in Akron at the university. I sit in supervision, discussing cases and offering feedback to my colleagues for 3 hours. Back in the car for another 2 hours. I can't believe I'm wasting another 2 hours in the car. I have to make it to supervision with my internship supervisor next. And I just spent 3 hours in supervision. So what I need to do with my case is this, this, and this. After supervision, I think I can squeeze in a few clients before calling it a day. I never made it to internship supervision that day, and I kissed my old life goodbye as I walked out the door that morning. It's been 105 days since that morning. After I ran into the back of a semi on 71, my injuries included a tear in my aorta, level 2 spleen, level 3 liver. My fractures were 6 ribs, left wrist, right hip, right femur, right patella, and right talus. The left wrist has metal plate and screws. My right hip has a screw. My femur has a rod and screws. The patella has a couple of screws. The talus has 2 plates and screws, as well as a bone graft for my hip in hopes of healing that frail bone. After my accident, I had an external fixator that ran up my entire right leg to stabilize my injuries.
Eventually, this would only be on the bottom of my leg for 3 months. The last of my injuries is still a concern for me. The nerves in my right leg have been stretched, so I'm unable to feel sensation below my right knee. But because of the help from people like you, I'm still able to stand here, even with all of these injuries. It's an honor to be here and to represent so many people's lives that each of you touch on a daily basis. When you experience a traumatic event, there are a lot of people involved in your recovery, from first responders, nurses, doctors, fellows, therapists, x-ray techs, case managers, even insurance and billing departments. These are people that you really never thought you would or could say became so close to, who were so invested and involved in your recovery. It has taken some time for me to get used to my new body and new life. A few weeks ago, I went shopping with my mom and little sister for the first time in months. And my sister saw a skirt. She said, "Mary, you should get this, it's so cute." I said, "I don't think I'll be wearing things like that anymore." We shopped a little more and I said, "Let's go back to that skirt. I'm speaking, and if anyone deserves to see my scars, it's the people who have saved me. So drink it in." I spent 2.5 weeks in Grant Hospital, where I felt care and consideration as if I was someone's family member. Families are constantly on my mind since I have been trained to be a marriage and family therapist. What exactly does it mean to be an MFT? It means to counsel others in a time when they are experiencing distress and need help. Usually, this is a last-ditch effort to get a family back on track. Since I've been trying to be a marriage and family therapist, it's all about the systems for me. Usually, nothing affects just one person. Every event, emotion, situation, achievement, failure, and crisis impacts each person that's involved in the familial system. As a marriage and family therapist, I'm used to these influences. And once you are converted or trained to think about systems, it's easy to continuously view situations or people within that therapeutic setting. Just like any family, there were some people I was happier to see than others. Dr. Pandya was never satisfied with my breathing, and I always dreaded it when he came to call. I guess he was the scary uncle in my family. However, I know why he did it. He wanted me to get better. This one's for you, Dr. Pandya. My favorite aunt was definitely Mary Lou. She's been with me and impacted my life in ways I didn't know were possible in such a time. Her radiant smile and laugh have the ability to take any situation and make it not that bad. This is what makes her a great trauma nurse, ICU nurse, flight nurse, nursing instructor, and supervisor. I hope I didn't miss any there. Even now, when I'm having a bad day, I think of her and I ask, are things going to get better? I see her smile at me, and she says, of course they are, just like she has from the beginning. She has the faith and provides everyone else the strength and hope until they have it too. This favorite aunt was accompanied by some awesome cousins on Wednesdays. Well, to the rest of you, they are her nursing students. We learned about my injuries and needs. I watched one batch leave with all of their knowledge and gave the next batch a crash course in the trauma patient. I hope she's okay, by the way. Dr. Shaw was the observant uncle who is a man of few words. He was always watching out for my aortic tear, but never wanted to create a big scare about the situation. Next are all of the ortho fellows, my older cousins who were knowledgeable and were able to tell me everything that was happening with my body. And they always answered all of my questions. Not every Q&A session ended with a smile, but they were always able to balance giving accurate information while being kind and empathetic. None of this would have been possible without Dr. Mehta. He's the screws that have kept the bionic woman, me, together. My jokester uncle. Before my third surgery, he asked me if I had any questions. It was a long day waiting for that surgery. I said, yes. Can I have a glass of water? He said, no, but nice try. He expects more out of me than anyone. And there are days when I curse him because I know I want to show him that I can do it. But it is so hard to get there. And when I push him back, he says, we'll see. Well, the last time I got an answer I didn't like, I retorted, we'll see. We can both play at that game. He smiled and winked at me. There's the feisty one he thought he'd almost lost. In 3.5 months, I have been through a lot. I have had many different feelings, accomplishments, and setbacks. I spent 1 week in the ICU, another week and a half on the 7th floor of Grant Hospital, which I like to call my second home. After that, I spent 4 weeks in a skilled nursing facility, being told I was way too young to be there. Then I would ask them if they saw my leg. After getting some great therapy, when I went into the facility, I could barely lift myself out of bed. By the end, I could hop on 1 foot with my walker for 250 feet, make it to the bathroom myself, give myself a sponge bath, and be alone for extended amounts of time. I was home for 4 days before being readmitted to Grant Hospital for a small blood clot. It was not a good day. But as always, my husband Josh has the best outlook and can always find a way to cheer me up. I'll never forget him telling me, Mary, give me 10 minutes and I can round up half of the 7th floor to come and visit you. Basically, for the next day and night, I was an honorary visitor. It was great. I got to see so many of the nurses who took care of me when I was really bad off, and now they got to see me sitting up in my wheelchair and looking really well. I would ask if people were working and if I could see them, spotted them from the hallway waving, and people would even see my name and come see what I was doing back and how I was doing. I was at my second home. Mary Lou brought in her nursing students once again. She loves to do this. I love talking to these young men and women, but I always find myself wondering what it is that she wants me to say. I tell them what happened to me, what it's like to be a patient. I thank them for everything that they do, because God knows I couldn't do it. And I tell them what it is that's important. Having empathy and instilling hope and patience is just as important, if not more, than being the best doctor or nurse available. After returning to my house for the second time, I began in-home therapy, and in 1.5 months, I went from using a gait belt jerry-rigged to my leg in order to lift it in and out of my bed and hopping on 1 foot to walking with a walker and weight bearing on my left wrist and 50% weight on my right leg. But there have been dark days too. I have felt angry and sad. I have been pissed at everyone for deciding that I deserve to live, that they needed to save me from that accident, that they were and still are relieved that I am here and getting better. But it's me that has to live my life this way, to make sense of my life while struggling through the recovery process. At the beginning, I told you about my busy and productive life. An average day is doing my exercises in the morning, eating breakfast, going to the couch, eventually eating lunch, watching TV, and waiting for my husband to get home from work. I have cried and told my husband that I do not have purpose in my life right now. I have asked, why did this happen to me? However, even on those dark days, I know why. I spent my life living 5 years in advance at all times. My mom used to say I was burning the candle at both ends. 12-hour days were like a cakewalk. I was the Energizer Bunny. At times, I would catch myself and I would think, I need to slow down and enjoy life, especially when I would see it through another perspective, like some cheesy movie, like Eat, Pray, Love. But then my morning alarm clock would chime, and it was off to the races again. That might work for other people, but it was not my time for an epiphany. Not yet. Mine came full force. Yeah, a semi in your windshield is pretty full force. I am now finally appreciating what it means to live, to experience the really important things in life. When I feel down, I look at my husband and think that he could have been a widower at 25 years old. But now we get to spend our whole lives together. I think of my beautiful nephews and niece and realize that I will live to see them go through life, and they will know who Aunt Mary is. I think of my best friend and inspiration, my little sister, and how she kept and that know that we don't have to live our lives without each other. I think of my older sister and how she kept our family together, that the accident made us closer than ever. I think of my brother and how he constantly kept everyone updated. And I think of my parents who do not have to bury their 24-year-old child. And I smile because I have been given the chance to do things right. A second chance at life. I don't know why I survived that accident, and no one else can tell me why either. It is now up to me to learn from my mistakes, and I hope to help others make sense of a new life that is completely different from their previous life. As an MFT, I have decided to specialize in medical family therapy. After seeing what my family and I went through, it would be the greatest gift of giving back to help other families survive trauma in the best possible way. I have had to say goodbye to so many people who have helped me, and each time it is difficult. My therapists tell me it's not sad, it's happy that I'm moving on. But the truth is, you form a bond. And yes, I get attached to these people. How do you say thank you for helping me through my bad days? Thank you for believing in me and telling me that things will get better. Thank you for showering me. Thank you for putting my hair in a ponytail. Thank you for 5 surgeries. Thank you for teaching me to walk again. Thank you for allowing me to feel beautiful again. Thank you for giving me my life back.
To see that list of traumatic diagnoses so long, and to see you standing up here in the short 3.5 months is truly incredible, and you are an inspiration for all of us. As a special surprise, we wanted to invite all the people that were the responders involved in the care of Mary. Would the associates from the emergency department at Grant, MedFlight, Ohio Highway Patrol, and the Troy Township Fire Department please come forward?
Thank you. Thank you so much. Thank you. Thank you.
You're welcome.
Thank you.
You look much better than you did that day. The leg looks good.
Thank you. Thank you. Thank you.
Yeah, yeah. You do a picture? You stay right. Josh and Mary, thank you again. Grant Medical Center, all the responders, OhioHealth, we thank you for, extending yourself and showing us your story. Thank you.